Surfactant. That is a topic which I'm going to show you conceptually by making the specimen of the lung and the alveoli. So here you see the trachea. This here is an alveolus. This here is again an alveolus on the other side. Now let's see in the video how the alveoli are getting inflated and what exactly happens when there is no surfactant and when there is surfactant. So now in the video, you can see that the alveoli are getting inflated. There is a difference in size. The one on the left, which I have magnified, is bigger than the one on the right. So why is that? That we'll see. This here is a small alveolus. This here is a large alveolus. According to LaPlace law, P is equal to 4T upon R, where P is the transalveolar pressure. I repeat, P is the transalveolar pressure. It is the pressure which is required to keep the alveoli expanded. It is the pressure which is required to keep the alveoli expanded. So according to this equation, P, that is the pressure, is directly proportional to the tension. In this case, it is surface tension. So P is directly proportional to surface tension, and P is inversely proportional to the radius. So as the radius goes on decreasing, the pressure goes on increasing, and as the radius goes on increasing, the pressure goes on decreasing. Now let us go back to this diagram. Here, the small alveolus has a greater collapsing tendency than the large alveolus. Why it has a greater collapsing tendency? Because it is small, so it can collapse very easily than the large alveolus. Much more, the radius of the small alveolus is less. Because the radius is less, the pressure is more. Now, since the pressure is more than what? More than the large alveolus. I repeat, the radius is less. That is why, according to Laplace law, the pressure is more. The pressure is more than the large alveolus. So, since the pressure is more, what is going to happen to the air? What is going to happen to the air? The air is going to travel from the small alveolus into the large alveolus. Because of this, as air is traveling from the small alveolus into the large alveolus, the diameter is further going to decrease. The diameter further decreasing will increase the pressure. Now, the pressure will increase till the alveoli completely collapses. This phenomenon is called instability of alveoli. Alveolus maintains same size. There are two factors which are responsible for this. The first one is surfactant, and the second one is interdependence. Now let us see what the surfactant does. Here, this is the small alveolus, and this here is the large alveolus. Now, in the small alveolus, the surfactant is usually at the lining, at the border, at the circumference. And in the large alveolus, the surfactant is also at the circumference. Now, as the alveoli becomes smaller, the concentration of the surfactant increases. Opposite for large alveolus. As the alveoli size increases, the concentration of the surfactant decreases. So, now the small alveolus, which is becoming more smaller, the surfactant size will increase. That is why surfactant will not allow the small alveolus to become more smaller because, like we remember, surfactant acts in this direction and surface tension acts in this direction. So, more the surfactant, more will be the expansion of the alveoli. So, that is why the small alveoli will not collapse. And opposite, the large alveolus, which has less surfactant, it will not expand more. It will not expand more because the radius is increasing and the surfactant is becoming less. So, what is going to happen in the end? The small alveolus contract less and the large alveoli contract more. This maintains the size of the alveolus uniformity. What is the second thing? The second thing is called interdependence. What is interdependence? All the alveoli are mutually connected to each other. Because of interdependence, all the alveoli have the same diameter. Since the alveoli are connected to each other, since they are connected to each other, it is difficult physically for one alveolus to contract without the other one contracting at the same time. This helps in maintaining the equality of alveolar size.